we know that the AR-V7 marker is present in castration-resistant advanced prostate cancer. Is it present in hormone-naive prostate cancer, or even in the primary prostatic cancer as well, in the prostate gland itself? And we don't fully know the answer to that. One of the things that we must remember is that the androgen receptor splice variants are induced by the presence of androgen deprivation therapies. In other words, the low testosterone level almost induces or promotes the increase in the AR, both by amplification or overexpression. And potentially as a byproduct of overexpression or amplification of AR, these AR splice variants also develop and emerge. So in the hormone-sensitive setting, in other words, hormone-naive patients, we're not sure if these splice variants will be important. One of the things which is currently being done to potentially investigate that is to examine radical prostatectomy specimens from patients that have undergone neoadjuvant trials to see whether the AR-V7 protein or even the AR-V7 mRNA can be detected in the radical prostatectomy specimens. And there are several studies which are ongoing right now where patients are receiving the novel next generation androgen receptor targeting therapies, such as abiraterone and enzalutamide. And we know that these agents do not generally produce complete pathological responses in the majority of patients. So many patients still do have residual tumor left behind at the time of prostatectomy, even if they receive 3 months or even up to 6 months of these novel AR-directed drugs. So one question which I think the field could answer, because we have the material available, is in those patients who don't have a complete or near complete pathological response after a long duration of AR targeting therapy, let's say 3 to 6 months of abiraterone or enzalutamide or the combination, those cancers that basically are refractory, do those begin to overexpress androgen receptor splice variants, including AR-V7, even before those cancers metastasize? And that might be an early hint about the evolution of the cancer, how it might change under the pressure of these very novel and potent androgen deprivation therapies. So that's something which I think the field could answer, because we have a lot of these radical specimens in our freezers.